When someone you love or care about has a mental health condition, it can sometimes be difficult for the entire family. But there are support services and networks that can help your loved one and your family get the help they need. And your local community mental health center can provide lots of valuable information about services. The truth is that there are times when local services and support just aren't enough. When you have done all you know to do, it might be time to consider the involuntary civil commitment process, which can ensure your loved one gets the treatment they need. After you've explored all of your alternatives, such as the mobile crisis response teams and crisis stabilization beds, there are a few steps you can take to start the commitment process.
The first step in civil commitment is a pre-affidavit screening process conducted by the local Community Mental Health Center, or CMHC. The pre-affidavit screening investigation includes an interview and investigation into the need for a civil commitment. To connect with your local CMHC for a screening, call their offices or their mobile crisis response team. Find that information at www.dmh.ms.gov, www.mentalhealthms.com, or by calling the DMH Helpline at 1-877-210-8513. The pre-affidavit screening must be completed within 24 hours of the CMHC being notified. If commitment is recommended, the pre-affidavit screener submits a report to the chancery clerk certifying that a less restrictive alternative treatment was considered and why it is not appropriate. The pre-affidavit screener shall refuse to support the filing of an affidavit if evidence does not support commitment. If a commitment is not recommended, the pre-affidavit screener shall provide the petitioner with connection to other alternative services and resources. If the interested person wishes to proceed with commitment contrary to the pre-affidavit screener's recommendation, application may be made to the chancellor. After the CMHC has attempted to complete an in-person screening, if the person is actively violent or refuses to participate, an affidavit may be filed and a writ will be issued for the sheriff to intervene. The CMHC will be required to document why the pre-affidavit screening could not be done. After pre-affidavit screening is completed and received, and upon filing of an affidavit of commitment, a writ is issued for the sheriff to take the person for examination and treatment by a local CMHC.
An affidavit, which is a form the Chancery Clerk's office provides to you, is just a truthful written statement that you file as an official record with the Chancery Clerk. When you file that affidavit, you'll pay a filing fee that won't ever be more than $150, and you do not need an attorney to start the process. If you are unable to pay the filing fee, the Chancery Clerk can provide specific eligibility requirements and instructions on how you can file for a waiver. After you file your affidavit, an order will be issued for the sheriff to take the person into custody. 2 healthcare professionals will do an examination within 2 days. And if the doctors find treatment isn't necessary, the case may be dismissed without a hearing. And if a hearing is required, it will be held within 10 days, and the judge will decide what type of treatment is necessary based on reports from the doctors and any additional evidence. The judge may decide your loved one needs treatment in a state behavioral health or outpatient program, and if the judge orders civil commitment, admission will be scheduled in the state hospital once a bed is available. Your loved one may also be referred to a crisis stabilization unit bed in the area. Transportation to the state hospital is provided by local law enforcement, which is for everyone's safety. And the admission process includes a review of medical records, general questions, and an inventory of your loved one's possessions. When your loved one is admitted, they will review program schedules, activities, rights, and responsibilities with staff. They will also create a treatment plan with goals and activities and a plan for discharge to help prepare for your loved one's return home, which includes connecting them to services and support systems in the community. Your loved one will be discharged when they no longer meet the criteria for commitment, and can return home with the necessary support services. After returning home, most people continue to receive treatment at a local community mental health center or other local programs that help them live independently in their own community. It's important to note that the court will maintain jurisdiction over people who are committed for 1 year after they complete their inpatient treatment programs. You should contact your local community mental health center to learn about services and support that can help avoid an involuntary commitment, including mobile crisis response teams, crisis stabilization beds, and other services that can work. The help you need may be a lot closer than you may think. For more information or to locate your local community mental health center, call the Mississippi Department of Mental Health Helpline at 1-877-210-8513 or visit dmh.ms.gov.